Dear audience, let me introduce my 6-month progress report. My name is Evelin Juhász, and my PhD studies about the applications of dietary fiber sources in patients with metabolic disorders. I graduated as a dietitian and as a nutritionist at the Semmelweis University, and now I'm a PhD student at the Doctoral School of Health Sciences, and my supervisor is Réka Hermanné Juhász. My vision is to normalize the metabolic disorders of the patients by receiving dietary fiber instead of taking any medication. And my mission is to draw attention of the physicians to the results of the studies regarding to the dietary management of polycystic ovarian syndrome. Here you can see the two projects what we are working on. In the first project, we would like to find out which dietary fiber seems to be the most effective on reducing glycemic and lipid profile in patients with type 2 diabetes. And based on the results, we would like to perform a randomized control trial. So my first project title is The Effects of Dietary Fiber Supplementation on Glycemic Control and Lipid Profile in Patients with Type 2 Diabetes. This is a systematic review and a network meta-analysis. A short background about the topic. 6.28% of the world population has type 2 diabetes, and in the first-line treatment, lifestyle management is essential. This management includes the medical nutrition therapy, which is recommended for all the patients who has diabetes as a good component of the overall treatment plan. And counting carbohydrate intake is necessary for these patients, and that's the reason why the dietary fiber could be a good solution for them, because much less amount of it enough to normalize glucose and lipid levels as well. And in the diabetes guidelines, there isn't any word about the dietary fiber. So our aim is to investigate the effect of dietary fiber supplementation on glycemic control and lipid profile in patients with type 2 diabetes. Our clinical question is, does dietary fiber intake decrease the hemoglobin 1C compared to another type of dietary fiber or no dietary fiber intake? The population is patients with type 2 diabetes. The intervention and the comparators are the same: soluble, non-soluble dietary fiber and no fiber. And the outcomes are the glycemic and lipid factors. Our hypothesis is soluble dietary fiber intake can normalize glucose and lipid levels in patients with type 2 diabetes. We did a systematic search in October, and on the left side you can see the flowchart of the selection process. We have 9 outcomes, but for now we only got results for one, which is the fasting blood glucose level. This test measure is a simple and common way to diagnose diabetes, prediabetes, or gestational diabetes as well. In the network graph, you can see the interventions regarding to the fasting blood glucose level outcome. This network includes 38 studies with almost 2,000 patients and 18 interventions included. The size of the nodes is proportional to the number of the studies evaluating each intervention, and the thickness of the edges is proportional to the each of direct comparisons. In this Sukra figure provides a posterior surface under the cumulative ranking curve estimates which fiber seems to be the most effective on reducing fasting blood glucose level. The higher the Sukra value and closer to 100%, the higher the likelihood that the therapy is at the top rank or one of the top ranks. So this analysis suggested that the 3 interventions, beta-glucan, inulin with resistant dextrin, and psyllium, are the 3 interventions has the highest probability on reducing fasting blood glucose level. And galactomannan has been shown to be the least effective on reducing fasting blood glucose level. League table estimates the interventions, the pairs of the interventions, and we got 3 significant results. Those patients who got beta-glucan inulin plus resistant dextrin and psyllium had a significantly bigger change from the baseline at the fasting blood glucose level than those patients who got galactomannan. As a summary, our study strength, this is the first network meta-analysis in the field of using dietary fibers in the therapy of metabolic disorders. It has rigorous methodology. We could find 18 interventions, and almost 2,000 patients were included in the network. And our limitation is that small number of the direct comparisons, and in the articles, the fiber therapies were very different amount, and the patients get very different therapies. For example, some of them did some sports and exercise or had any other oral medications. In conclusion, the beta-glucan dietary fiber showed the highest effect on reducing fasting blood glucose, and grading the fibers, the first one was the beta-glucan, the second one was the inulin with resistant dextrin, and the third one was the psyllium. And I must say that further outcomes results needed to evaluate metabolic effects of dietary fibers intervention in patients with type 2 diabetes. And the implication for practice, dietary fiber seems to be a beneficial alternative treatment reducing fasting blood glucose level. And the implication for research, beneficial effects of dietary fiber should be assessed on other types of disease, which include metabolic disorders like PCOS or metabolic syndrome or obesity. Our second project title is The Effectiveness of Dietary Fiber on the Ovarian Function and Metabolic Balance in Women with Polycystic Ovary Syndrome. A background about the topic: PCOS is one of the most common endocrine disease of reproductive age women, and it has more clinical manifestations like elevated serum androgen levels, menstrual cycle irregularities, anovulation, and significant number of the patients has insulin resistance, hyperinsulinemia, and obesity as well. In the first choice treatment, these patients get insulin sensitizers, which has short and long-term complications. And that's why dietary fiber could be an alternative treatment for them. Our aim is to examine the effects of dietary fiber in the treatment of PCOS. Our clinical question is, can dietary fiber improve metabolic disorders in PCOS? The patient is women with PCOS. The intervention is a soluble dietary fiber, and the comparator would be a placebo. And our outcomes are the ovulation, the menstrual cycle regularization, and additional outcome are the glycemic factors. Our hypothesis is soluble dietary fiber is not inferior than metformin in the treatment of women with PCOS. And the clinical implication is to improve ovarian function. Actually, the protocol drafting is under discussion. We had an interdisciplinary discussion with Professor Dr. Várbíró and Professor Dr. Ács. So we would include those women who are aged between 18 and 45 and diagnosed with PCOS and has a higher BMI than 25 kilogram per square meter. And we would exclude those women who are pregnant or lactating or using any other contraceptive medications or hormonal therapies or had previous surgery or any symptoms of thyroid glands on disorders and Cushing syndrome. The intervention would last 3 or 6 months, and in the arm A, the patients would get soluble dietary fiber, and in the arm B, the placebo would be maltodextrin regarding to the literature. This is the most common used placebo. And our primary outcome would be the ovulation and the menstrual cycle regularization, and the secondary outcomes are the BMI, the metabolic parameters, and the hormonal parameters. So we are planning to submit these two projects in May and July of 2022. And as a dietitian, I can't say anything else than Hippocrates did. Let food be thy medicine and medicine by thy food. Thank you for your attention.
Actually, I have a question regarding your network analysis. So you found actually 3 types of fibers that have similar effects. But I'm really curious, how would you choose out of these three fibers, which one would you give? I mean, of course, there are other factors that you have to take in consideration if you are giving these kind of supplements. I mean, there are anyway differences. What additional parameters would you check if you would have to choose out of these three interventions, let's say?
Thank you for your question. Actually, we have only this one result, and the most effective dietary fiber was the beta-glucan, and I will choose this one because it has natural sources. For example, the patients get beta-glucan from oat or barley, and so they don't need to get the dietary supplementation for this fiber. So that's why maybe I would choose this one.
Thank you for your presentation. I just wanted to ask you that you presented so many different fibers. Are those all available in Hungary, for example? Can you just go into a store and buy one, or you have to contact a dietitian to get those?
Thank you for your question. Most of them is available as a dietary supplement, so you can buy them. Yes.
Congratulations on your work. I'm so sorry for my voice. So my question would be that what can be the physiological background of the blood sugar reduction in case of, for example, a B-glucan intake? Have you any idea why, for example, the B-glucan was the most effective?
Thank you for your question. Actually, in most of the articles, there were beta-glucan, so we had the more results for the beta-glucan, and it could slow the absorption in the gastrointestinal tract, so maybe that's the reason why it could be. And the amount of it, so beta-glucan was a higher amount than, for example, psyllium. Patients get in 10 or 20 grams per day, and for example, from inulin, they got only 5 grams. So maybe the amount is very important from them.
Okay, and what if I just increase the amount of the inulin, for example?
Maybe it could be
Can it be as effective as, for example, B-glucan? So it only depends on the amount that I intake, or?
Actually, I don't think so. Further research needed.
Okay, thank you.
How about the price of this? Because maybe the patients have to take it for long, so maybe that is also a kind of significant factor.
Thank you for your question. I think the patient should get it at least 6 months for each any other result.
Yeah, what I'm asking is, some of them are very expensive and another one is kind of fairly cheap, or what's the financial?
I don't think that they are so expensive. I think they are cheaper than the medications.
Yeah. So by the way, that's easy to say that maybe you could increase the inulin kind of dose 2 times more, but how about the safety? Because probably these are well tested, actually, I mean, alone. So is there any safety concern if you overdose this?
If you over-consuming these fibers, there would be any symptoms on the gastrointestinal tract, so I don't suggest that over-consume these fibers.